Good evening, everyone who's joined in on a very busy Monday, Tuesday, in fact. So it's been snowing in Calgary, but we are all here tonight, joining in from different cities all around Alberta to present this very important topic tonight. So on behalf of APNA, Alberta, I would like to welcome you. I'm your host tonight. My name is Dr. Sarah Makhdoom, and I'm a practicing family doctor in High River, Alberta. I'm also a clinical assistant professor in the Department of Family Medicine, and I've been in practice in a rural hospital for about 20 years now. So it's my great honor to present this amazing topic tonight, which will cover the pathways for Canadian practice. And most IMGs will benefit from this. And I'm sure that more conversations will start, and hopefully they will find the right pathway for them. So we have a lineup of really good speakers, but I would like to introduce our APNA Alberta president tonight. His name is Dr. Saad Yassin, and he's one of the founding members and also the president of APNA Alberta right now, which is the Association of Physicians of Pakistani Descent of North America. So we are all trying to help the IMGs, and Dr. Saad is one of those who's taken the lead in this process. He graduated in medicine from Karachi, Pakistan, and then he moved to England, where he did further training. He did his MRC GP and then practiced for a while before coming to Calgary. And he's been here for more than 10 years now as a family doctor. So he has his own story to tell, of course. And all of us have a different story, absolutely, that we can share and give you some pointers about tonight. So Dr. Saad, please go ahead.
Thank you very much, Dr. Sarah, for your kind introduction. First of all, I would like to welcome all the audience on behalf of APNA Alberta chapter. It's going to be a great event, and I wish you all the best for your future endeavors. I would like to thank Young Physician Committee of APNA Alberta chapter, who has worked hard to organize this event with me, especially Dr. Sarah Makhdoom, who is going to be our moderator, host, and panelist. And we have great speakers, Dr. Zoya Khan, Dr. Farah Naz, and Dr. Faria Kamal. And also thank you to our panelists, Dr. Zarka Qureshi, Dr. Maria Hussain, and Dr. Samir Rashid. Again, thank you so much. Wish you all the best again. Thank you, Dr. Makhdoom.
Excellent. Thank you so much. So we will proceed with our program tonight. I would like all the people to put their phones on a silent mode, and then speakers will keep their mics closed until they are invited to speak, so that we don't have too much extra noise in the speakers. If you cannot hear them, please let us know through the chat box. If you have any questions, try to put them in the Q&A box, and then we will try to answer them after the 3 talks are done. So we will give a lot of time for question and answers. So it's my pleasure to invite our first speaker tonight. We will start with the Canadian Pathway Through Residency program, which is CARMS. And we have an excellent speaker tonight, Dr. Zoya Khan. She is going to be telling you about the CARMS pathway. And she graduated from Bakai Medical University in Karachi, Pakistan. And then she did her family medicine residency at University of Calgary in 2021. And now she's working in Chestermere, Alberta as a family doctor. So I welcome her tonight, and you can share your screen, Zoya.
Thank you, Dr. Makhdoom, for the introduction. I will start with my screen share. Can you guys all see?
Yeah.
Okay. Before I begin, I want to say good evening, welcome. This is going to be a bit of a journey, but if we can do it, so can you all. So with that, just a couple of pointers before I begin. My journey was only in Alberta. University of Calgary is, as Dr. Makhlouf pointed out, I did my residency in. If you are looking to apply in different provinces, I would highly recommend you go on CARMS and you check what the eligibility requirements are for each province. Familiarize yourself with each and every resource. I will be pointing it out throughout my presentation, and they will be summed up in my final slide. So if you want to make note of that, please do so. With that, I'll start with my first slide. In a nutshell, this is the requirement that you will be needing. And I will be talking in detail about each and every step of this slide. Step 1. This is to pass your Medical Council of Canada qualifying Part 1 exam. This exam is a clinical scenario based / MCQ exam. You want to get this done by May to July of your application year. Now, just a little bit about this exam. When you're preparing for this, you may have come across the book for this exam, which is Toronto Notes. I found that book to be difficult to retain. So I started looking for resources to help me study. And I came across, which you may have already discovered, it's called the Alberta International Medical Graduates Association. This is different from AIMGP, which is the residency program. So this is an organization that works out of Calgary and helps you prepare for exams for anything residency related. So I would highly suggest you get in touch with them, get the membership, and enroll yourself in those classes. The other newer organization is the Direction for Immigrants that is working out of Bow Valley College. And it's a really good resource. And this brings me to the next exam, which is your NAC-OSCE, Step 2. This exam, so while the MCCQE1 is your theoretical exam, NAC-OSCE is your clinical skills exam. This is where you will be examining a patient, not an actual patient, but in front of an examiner and showing your examination skills, your communication skills. Ideally, if you can pass this in either a March session or enroll yourself of September session of the application year, that'll be great. Now, to prepare for this exam, again, speaking from my personal experience, I went through Directions for Immigrant and I went to Bow Valley College and I liked their classes. Reason being is that they have internists coming in who are going to watch you. They're going to make you go through the exam skills, how to present your case, and they're going to fine tune your skills. I would strongly encourage you to pay attention to these sessions, especially these sessions, because they will provide continued benefit. Even when you get into the residency, you will be already familiarized with how you're going to talk, how are you going to communicate, how are you going to present the case. This carries a lot of weight. Now, let's go to our next slide. Okay, if you're applying in Alberta, English language proficiency exam, get this out of the way at least a year, if not 24 months prior to applying for your residency. Do not underestimate this exam. This was taken quite lightly by some of my colleagues they were stuck on this exam for months. That's $300 every session. And I do wish that they bring about some changes, but for now, this is what it is. The 3 tests mentioned on my slide are the accepted tests: IELTS, the Occupational English Test, and the CELPIP. As you can see, all of them are to be completed within the 24 months before submitting the application. Scores are mentioned in front of it. Resources. Again, AIMGA, Direction for Immigrants. Both of them have classes to prepare you for this exam. Some of my colleagues reached out to past examiner, like previous examiners for IELTS, for private coaching. That worked as well. There's a little website at the end of my slide. These are exceptions, like, and you can see when you, and this site will be mentioned in my final one with all the resources. If you are belonging to certain countries or English being as your first language, then you're exempted from this exam. Step 4. Now, that's providing proof of status in Canada, whether you're a citizen or you have the permanent resident status, you are required to give that as proof of status by the AIMGP. And it's clearly outlined what exactly do they want on their website. So aimgp.ca. You will go on that site to see what exactly do they mean by providing proof of status in Canada. Once you're done with that, now is the time where you're going to apply through AIMGP portal for residency to see if you're eligible to apply in the CARMS and for more exams. Now, again, one very important point, if you have been to AIMGP website, now they have posted the 2024 list of documents and deadlines. Again, I would strongly encourage you, look at the document lists. Don't be stuck about asking your relatives back home to send this document, that document. Have it ready, have it notarized, whatever that means for you. Do that so you can register yourself on physiciansapply.ca and have all your documents source verified, so you have your package ready to go in that year of application. So once you're done that and they've deemed you eligible, they're going to call you for more exams. So step 6 is multiple mini interview. This is an oral exam. This will test your critical thinking. Now, this is a series of 6 to 10 interview questions, interview stations, each focused on a different scenario. This will test your ethics. This will test your communication skills, competencies like oral communication, teamwork, that are important indicators of how an applicant will interact with patients and colleagues as a physician. Now, just like how you would organize an essay in your, like when you're writing it, think of it of this way. You're going to organize your answers when you're giving the answer for the clinical scenario. Don't just start talking. Please take time, even if you have to take a few seconds to organize your thought, because whatever is going to come out is giving you the marks for it. The higher you score on this exam, the better your chances are. Step 7 is a newer exam. It's called the FM Pro C. It's a written exam. I did not have to give this exam, so I'm not entirely familiar with it. But from what I have gathered from my colleagues and friends that have given it, it's an online 60-minute situational judgment test. It's also an ethical exam. They're still testing you. It's one of those exams where they'll give you the choices and you have to rank each and every response to however you think should be prioritized based on the clinical scenario. It's testing you on professional integrity, adaptability, team working skills, and compassion. And the above would be done somewhere in October of the applying year. So now you have the exams done, your eligibility has been done through AIMGP. Now is the time to apply for CARMS. This may seem like an overwhelming task. It is a bit, I'm not gonna lie, but you can get this done. It's gonna take a while, but it's gonna you're gonna be over it. The two things that I want to point out when you're applying for CARMS is your CV and personal statement. CV, I didn't even know what CV was when I was in Pakistan. So when I came here, I took whatever classes I can to make a good one. Remember, a long CV is not going to get you in, but an efficient CV that's even a 4-page long but flows really well is going to work nice. That is your strong CV. That'll be the key. Again, take all the classes. AIMGA and Direction for Immigrants have classes for CV. They will show you sample CVs of how to make a good one. So attend those, take whatever help you can. Personal statement issues, please do not overcomplicate it. You're all physicians. You have all unique experiences, clinical encounters. You can pick up any example you want and put this nicely in your personal statement, and that'll be it. The relevance of this is going to be revealed in the next slide. And yes, one more thing. Whatever experience you have here, observerships, volunteer work, very, very important in your CV. Put it in, even if you did it for a week, or if you've done this for half a month in a doctor's office, in whatever capacity, put it in. It's going to help. Okay, now, residency interviews. It was, as much as I was scared, it wasn't that bad. There are 2 interviewees that's going to be sitting there. You're going to go in with confidence, good eye contact. Prepare for the interviews by attending the mock ones that will be again arranged by AIMGA and Direction for Immigrants. The second thing is know your personal statement, because that's what they asked. They didn't ask me about my CV. They didn't ask me about my qualifications or where'd you do this or do that. It was all about my personal statement, my clinical encounters, what worked well, what teamwork, how did you study? And that is your CanMed roles. I've included a site resource in my final slide to for you guys to see what CanMed roles are. CanMed roles, personal statement, that's your interview. I don't know if the pattern has changed recently, but once you attend the classes for interviews and mock interviews, you'll know more. Direction for Immigrants have actually called internists for this as well. And they were the ones who took our interview. Worked really well. Okay. Once you're done the interview, you're going to start your externship. Externship is promised the last assessment. It's 2 months long. 1 month for internal medicine, 1 month for family medicine. Again, remember when we talked about the NAC-OSCE classes and all, that's where it's going to help. When you are already familiar with the etiquette of case presentation and you're going to be studying, I have zero doubts that you guys already know about management of common cases for both internal medicine and family medicine. It's all about how you're going to present it. Resources I used is Approach to Internal Medicine by David Hui. It's a wonderful, great book. Pocket Medicine, Massachusetts General Hospital Handbook of Internal Medicine by Mayor S. Sabatine. And the program is going to give you or provide you with information or get you in touch with a senior resident, a second-year resident who is going to be of great help. They're wonderful. They will tell you exactly what their experience was and their IMGs as well. So that is going to be of great help. These are the sources. I think that this presentation will be available for you later on as well. As you can see, the last resource is about the important dates and deadlines. Please make note of all of these sites. They're extremely important. And with that, I conclude my presentation. I'll hand it back to Dr. Makhdoom. Any questions coming my way, I'll be happy to answer. Good luck, everyone.
Thank you, Zoya. That was an excellent overview of the residency pathway. I'm sure many of the candidates will be the ones that will need to follow that. And we will try and answer questions as we see them in the chat box down below and in the Q&A box. So moving on to the next talk, we will be talking about an alternative pathway to practice and residency, and that is the clinical assistant program. Many of our doctors on the panel today have gone through this program and then successfully matched through CARMS as a resident and then are now in practice. So this is a very good pathway in which you will actually do hands-on work, and somebody will be teaching you how to practice in the Canadian system in the proper guideline methods. So let's talk to Fariha, Dr. Fariha Kamal. She graduated from the Shifa College of Medicine in Islamabad, Pakistan in 2013. And she went through the clinical assistant pathway, and now she's working with the hospitalist team in the very prestigious University of Alberta Hospital in Edmonton. So Fariha, please go ahead.
Hello, everyone. So I hope you can all see my screen. So today I'll be talking about the alternative career pathways available for IMGs in Alberta, and we'll be discussing the Alberta Clinical and Surgical Assistant Program. So what is a clinical/clinical surgical assistant? So this is a role that is available with Alberta Health Services and is only for eligible IMGs. I will discuss the eligibility criteria in detail further in the presentation. A clinical or surgical assistant is defined by Alberta Health Services as a mid-level provider who works under supervision of attending physicians. So in short, this is a role which is somewhat similar to the medical officer position, which is available in Pakistan in terms of the duties and responsibilities. It's important to note that this is not a training position. It's usually hospital-based role across different departments, and the clinical assistants are also licensed under a limited practice register from the College of Physicians and Surgeons, Alberta. So I talked about the responsibilities, and the responsibilities of clinical assistants can vary across different departments, but most of them will require you to be able to take and document a good history, complete a physical examination, and make a treatment plan in consultation with the attending physicians. You will also be required to enter orders into patient care electronic or manual systems. And please don't worry about this because training for this is provided after being selected for the position during the probation period. So it's important to note that. And so the surgical assistants also provide pre and post-op care and assistant surgeries, which is a little different than the clinical assistant role. The clinical assistant look like? So there's a lot of variability in terms of the schedule when it comes to working as a clinical assistant based on the service or the department that you're working with. Some departments do require overnight coverage or weekend coverage, whereas others don't. Generally speaking, clinical assistants work about 50 hours a week and usually not more than 15 hours a shift, but then again, it is quite variable. So the next important question one might ask is why choose this role, right? Well, it does have its benefits. Firstly, it allows you to work in a Canadian healthcare system as a licensed physician. And it's also a great learning opportunity to expand on your skills. Furthermore, it is a paid job, which is always good and a bonus. And it can also help in getting good reference letters based on hands-on clinical experience if you're interested in applying for a residency training program. I think that's the most valuable thing out of this job. So now that we've covered some of the important pointers about the roles and the responsibilities, I will go over the application process. I've oversimplified this in 3 main steps, but these are the 3 steps you need to complete in order to apply for this role. First of all, review the eligibility criteria, and then apply for the pre-screening process. Once that is complete and you have your eligibility letter, then apply for the jobs posted on AHS website. So what is the eligibility criteria? The first prerequisite of the eligibility criteria is that the candidates should be eligible to work in Canada and should either be Canadian citizens or permanent residents. Next, the applicants must be a graduate of a medical school which is located outside of Canada and the US, which will grant them to be IMGs. And the school should be listed in the Foundation of Advancement of International Medical Education and Research, International Medical Directors. You can usually search their website to find your medical school's name in there. The candidates must also have passed MCCQE1, and they should have completed 1 year of postgraduate training, which must be supervised and must be hands-on and should take place after the completion of undergraduate medical education. So the house job that we usually do in Pakistan fulfills this requirement. They have recently added another clause, which is the recency of practice, and that's an important prerequisite. It states that the applicants must provide evidence of being in discipline-specific postgraduate training or independent practice within the last 3 years. Last but not the least is the English language requirement, which I will discuss in the next slide. So for the language requirements, they do accept either of 3 different examinations, namely the IELTS academic, the occupational English test medicine exam, and the CELPIP general examination. They all have a specific minimum score requirement. Most importantly, these English language examinations must be taken not more than 24 months prior to submitting the application. So after reviewing the criteria and completing MCCQE1, the first step that I would recommend would be to create a source verification request for your medical degree, transcripts, postgraduate medical education certificates, and if needed, certificate of proof of name change. These documents will need to be shared with Alberta Health Services through Physicians Apply. I recommend starting with these as this process can sometimes take a few weeks and it's better done sooner rather than later. The next step would be to get your IELTS test results notarized or any other English language test that you have taken. Next, please fill out the application form and attach your resume as well as a notarized copy of your IELTS or any other English test results and email it to ca prescreen@ahs.ca. Also, do not forget to share your source verified documents via Physicians Apply. So here's a picture of the document checklist that's available within the with the application form. I've just attached it here for your review. You can see that it has a very nice checklist, and so that way you won't be able to, that way you'll be actually able to complete all the documents needed. So this is the final step of the process. Once you receive your pre-screen letter from AHS, you can apply for jobs posted on the AHS website. A really important thing to note is that the pre-screen letter will have an expiry date on it, which will be directly linked to the expiry date of the language test results and also pending on the recency of practice. So please make sure that the language test results must be current within 24 months in order to obtain licensure. And the recency of practice must be within 3 years. Whichever expiry is sooner will be the date of expiry listed on the pre-screen letter. So here are some important web links for your reference. You can look up the clinical assistant roles and responsibilities on this website, and then also get the pre-screen, know more about the pre-screen process through the other link. So this concludes our presentation. Thank you so much for listening, and I wish you all good luck for your future endeavors. We will be taking questions at the end of all the presentations, so feel free to ask any if you have. Thank you.
Thank you very much, Faria. That was an excellent talk, and I think it will,
You're welcome.
incentivize people to start thinking about this pathway, definitely.
Absolutely.
And it absolutely increases your clinical acumen and your capacity to, work appropriately in the environment that you're in. So moving on to the third topic, this will be about the practice readiness assessment program, and it will be talking about family medicine as well as some specialties, because both are eligible for this. And this is present in Alberta and also in other jurisdictions, different provinces like Newfoundland, BC, British Columbia, and many others. So I think candidates need to look online to see which one works best for them and where their family is or wherever they are landing in Alberta or in other provinces, then it will be, according to that plan. So for this topic, I will invite Dr. Farah Naz. She is a recent candidate who has successfully completed this program, and she is now practicing in Medicine Hat for the last 1 year as a family doctor and hospitalist. And her story started in Pakistan, in Sindh Medical University, Karachi, Pakistan, and she graduated in 2009. So we will ask her to share her experiences with you, and hopefully everybody will benefit. Welcome, Farah.
Hello. So I'm going to first share this screen. Thank you, Dr. Mafoon, for the introduction. So I'm practicing here in Medicine Hat. This is one of the city in Alberta. So I'm going to base this presentation for the province of Alberta practice readiness assessment. Somewhat all other provinces have similar kind of requirements with some minor differences. So I would really appreciate if you're looking for other provinces, go to the CPSA PRA website and try to search in detail what are the requirements you want. But overall, I think this is what every province somewhat needs for PRA. So it's a very straightforward pathway. If you are very well prepared with all the eligibility requirements, it's not going to take a lot of time for you to enter into the Canadian medical system. Basically, as you can see on the screen on the first slide, it defines what is practice readiness assessment. This is basically a required final step of an alternate pathway to independent practice. So IMGs who do not have complete credential, Canadian credential, PRA is one of the pathways that can enable them to practice medicine in Canada. PRA is also offered for other specialties, but definitely the requirements differ, and I'm not going to cover this in this presentation. When you look at the bottom of the slide, you will see some steps at the bottom. So review of qualification, then eligibility letter, and I'll be explaining each of these steps in the other slide. So we will move to the next slide. 7 steps to get your independent practice permit in Alberta. So step 1 includes almost 5 requirements. Medical degree. The medical degree needs to be from the medical school that's listed in the World Directory of Medical Schools. And this is all available on the Practice Readiness Assessment website from CPSA. So if you search on that, you need to see if your medical college or medical school degree does belong to that directory or no. Now, the second requirement is English language proficiency, and both of my colleagues for clinical assistant and residency training have explained it very well, so I will not go in depth of it, but definitely IELTS academic and or OET medical examination is required. When I did it, I completed my practice readiness assessment in 2020. I started it in 2020 and I completed it in 2021. At that time, until October 2020, they were not accepting anything else other than IELTS. So this is something new, OET exam. I do not have complete information about that, but I think it's somewhat similar to academic IELTS. Now, the other requirement is MCCQE Part 1. This is a qualifying exam specifically for Canada. So it's a one-day exam and it's computer-based. It's not clinical assessment exam. Now, people who have done their USMLE exam, if they have completed their USMLE Step 1, Step 2 CKNCS, and Step 3, then this exam is exempted. But if, for example, you have done USMLE Step 1 and Step 2 CKNCS and not a Step 3, then you cannot be exempted from the product. So that's one information. The other requirement is currency of practice or recency of practice. For that, it's basically within the last 3 years, you need to have been a part of a continuous, uninterrupted postgraduate training in family medicine. and that should be for a minimum of 1 year. So I want to make it clear that training that's continuous and uninterrupted has to be 24 months of training. But the 1 year should lie within your past 3 years when you are applying. Okay, so the other requirement is postgraduate training requirement. And again, this is a continuous university affiliated family medicine postgraduate training that you will do for a period of 24 months, consecutive 24 months. And this includes these specific rotations at least. So if you count all these weeks of rotations, you will come up with a sum of 12. But it's not 12 months of rotation, it's basically 24 months of rotation. So you have to complete 12 more months, either to complete within this specialty or subspecialty will be included as well. So at least 4 months of community-based primary care. By that, what they mean is basically clinic. Community-based clinic, for example, because I did my training in Pakistan from the University of Health Sciences. They do offer this program, community-based primary care is one of the rotation that we have to do, and it has to be at least 4 months. I mean, you can do 6 months, but has to be minimum of 4 months, and then you do serve in the community. And then at least 8 weeks of practice in pediatrics. So you will get your rotation of 2 months in pediatrics, 2 months in obstetrics and gynecology, 2 months in surgery, and then 2 months in internal medicine. And this may vary, but not minimum less than 2 months or 4 months for family. Okay, now I would move to the next step. This is a step number 2 and a very important step because physiciansapply.ca account is the main portal which you will use throughout the process. So you will apply for exams to this account. You will submit all your credentials to this account, and then you will get this source verified by your relevant authority back where you did your training. And then ultimately you will be able to share all this to CPSA. CPSA only accepts applications to physicians apply and no other portals. So even if you have done your USMLE, you are ECFMG certified, whatever you have to upload to physicians apply, and they will share. So through this account, as I said, you can do a lot of activities like uploading your exam results, sharing it with CPSA, then other step for the practice readiness assessment, which comes with the review of qualification that I will be discussing later, also comes through the same account. So I will now proceed to step number 3. So this is the step number 3, which means that you need to submit a review of qualification to CPSA. Once you open the physicians apply account, or so once you submit all the documents to physicians apply account, you will need to submit a review of qualification to CPSA from that account. There is a cost to it, and it's a non-refundable fee. CPSA registration administrator. So once you submit everything, CPSA will assign you an administrator. That administrator will review and send you an eligibility letter at that point. Once you get the eligibility letter, then you will enter into step number 4. So when I did my assessment until October 2020, this was a little bit different. We used to do the TDM exam first, and then we submit those results, share it to CPSA through physicians apply, and then they issue you the eligibility letter, and then you get for security a AHS sponsorship. This is now a bit different. So you secure your eligibility, you receive your eligibility letter first, then you have to do 2 things within the next 1 year of your eligibility letter, because eligibility letter will expire within the next 1 year. So I will proceed with next step. Step 4 is secure AHS sponsorship. AHS means Alberta Health Service, because I'm speaking all about Alberta, so that's what it is. And apply to sit the TDM exam. TDM is Therapeutic Decision Making Exam. So after you get your eligibility letter, you have 12 months to get both of these things done. So you have to write the exam, which you will be preparing, of course, after your completion of training, you will continue to prepare for that exam. And once you get the eligibility letter, you will secure AHS sponsorship. Now, what is that? AHS sponsorship. So basically, there are different jobs that are being posted on a website, drjobsalberta.ca. When you Google that website and you open this website, you will get, you'll have to make an account on that website, and you will see different positions appearing. And then you will have different jobs appearing on that website, and you will apply to the job that holds AHS sponsorship. So when you will apply that and they approve you, then you will get the AHS sponsorship, and simultaneously you will be done with your exam, TDM exam. And that then you contacted by your registration administrator to go to the next step. The next step would be the CPSA registration administrator will let you know what documents are further required. There are many different documents they require. Some documents do ask you to complete to give you the explanation of your gaps in your practice. So for example, if you graduated in 2012 and you are applying in 2024, until then what has been your journey? So you have to write down on a paper, on a document, and then mail it to them. So that's your fifth step. After that, CPSA will set up your assessment. This is practice readiness assessment, and it has two components. First 3 months is preliminary clinical assessment, PCA. You will be assigned a CPSA approved assessor that will review your clinical expertise. The assessor will be responsible for all the care, and he will be the physician in charge for the patient, but definitely you will be assessed by the assessor. So you will be doing a lot of things in patient care that you will be assessed on. The next step is another 3 months, and it's a supervised practice assessment, which means that there is no assessor, but a supervisor. This is also a 3-month assessment, and CPSA supervisor will visit you regularly. During my assessment, my supervisor used to come once a week to my clinic, give you all the charts with me and my plans and all that. So this would not be on a daily basis that he or she will be coming to your clinic to assess you. But as compared to PCA, where we will be under assessor every day with every case. But in this one, you will be practicing independently. You will be the physician in charge, responsible for your patient care, and then you can bill Alberta Health for medical services. But here comes the responsibility as well. CPSA supervisor will visit you regularly, and once you pass the assessment as well, then you will be issued with an eligible practice permit. This practice permit, the one thing that I want to tell you, so there would be different, this would be the practice permit after your completion of assessment, but you will be given a practice permit at the beginning of your assessment as well for both assessments. So that's a different practice permit, but then this permit would be definitely a permanent permit. You will be getting a provisional register, not a general register. So after whatever your contract would be with AHS, after you complete that, and after you complete your exam, CCFP exam, sorry, then after that you will be able to apply for general register, or you will be switched to general. Now I have a few points that I would like to emphasize for my friends, colleagues who are practicing outside of Canada. While you are doing your training in, let's say, in Pakistan or any other country, I would highly recommend, and that was I was doing when I was doing my training, get yourself familiar with all the guidelines over here, because once you enter the system over here, or once you try to apply, it's very limited time that you will get to read all that. So during your training, start looking for different guidelines that apply to Canada. For example, specialist link pathway towards optimized practice TOP guidelines for Alberta. Then therapeutic therapeutic choices is a book that's available in Canada. I don't know if it's available online, but that's a very good book. It has all the medications with doses, side effects, and this is what your exam is around in therapeutic decision making, the exam that I mentioned in one of the slides. The whole exam is based on the therapeutic skills. This is a clinical scenario-based exam. not a clinical, it's a written exam, but it's a scenario-based exam where you will be asked to, you will be presented with a scenario, you will make your differential, most accurate diagnosis, first step in management, all the red flags, and all those, and then write a prescription, and then your follow-up plan. So they will assess you on that. So I would say for TDM exam, these are the tips that you would have to, I would recommend you for. So I think this overall concludes my presentation. I wish you all the best. I would be happy to answer any question at the end of this session. And if there would be any question, thank you very much.
Thank you, Dr. Farnaz, for an excellent topic presentation tonight. I'm sure lots of people will benefit from that. I think I will move on to introducing the rest of our panelists tonight, who have a lot of combined experience of getting into practice here. So first of all, I would like to introduce Dr. Zarka Qureshi. She is a family doctor in Calgary, and she will tell you about her experience.
Thank you, Dr. Makhdoom. Hi, everyone. My name is Zarka. I'm a graduate from King Edward Medical University, Lahore, Pakistan. And like Dr. Makhdoom said, I'm currently working as a family physician. So like I think all IMGs, we all have our own journeys. We all have our own challenges. So my biggest challenge when I started for this struggle was a gap in my clinical experience. So I did lots of observerships here, both in the clinical and the hospital settings. And I was lucky to get into the clinical assistant program. And I worked 4 years in that in the medical and radiation oncology at Tom Baker Cancer Center as clinical assistant. Dr. Priya already explained, that what's the hands-on experience as a clinical assistant, and definitely that helped us all grow both professionally and personally while working in the clinical assistant program. I think every experience that I get was a stepping stone towards my goal to residency, and clinical assistant program really helped me to get into my residency program. So I did my residency at University of Calgary. And now I'm working as a family physician. So from my struggle, I think I can say few take-home message or advice. First is be persistent and be positive. Second, I think even if you have a gap, you can get into the Canadian healthcare system. And the third, I think already Dr. Zoya mentioned that it's very important that we pay attention to the requirements at the CAMS application, CAMS website, because they usually mention what qualities they are looking for in the personal letter, in the application, and make sure you speak to those qualities in your application. So application is really important. Best of luck, everyone, and we will be happy to answer your questions. Thank you. Back to Dr. Makhdoom.
Thank you, Dr. Zarka. Of note, Zarka is also heading quite a few committees for young physicians in the APNA community. So she is actually giving back tremendously to the next generation of physicians. So I will now introduce Dr. Maria Hussain. She is also working in the clinical assistant pathway, and she will share her experiences today.
Thank you, Dr. Makhdoom. Hi, everyone. My name is Maria. So I'll share my journey, and I like how Dr. Zarka approached it with what she learned along the way. So I'll do something similar. So I graduated in 2014. It took me about 3.5 years to get into residency. So I don't think any timeline is too short or too big. You can get in at any time. After graduating, did a year of rotating internship. So even if you're not physically in Canada, I was in Saudi Arabia at that time. I flew a couple of times and gave some of my exams from there as well, and then some here before coming. During that time, I also did observerships 1 month at a time. And ultimately, this led me to my clinical assistant position. So I know some people have commented that they're trying to apply multiple times. So you just have to be at the right place at the right time. And that was the case for me. So I did an observership in oncology, and subsequently a clinical assistant job opened up in oncology, and I applied for that. So like Dr. Qureshi, I also worked in radiation and medical oncology as a CA for 1 year, after which I applied to my first CARMS and did not match. So that does not impact you adversely either. So keep trying. So I applied a second time. And that's when I got the interviews in internal medicine that I was looking for. And that's when I matched. I think big takeaways for me was when I did my exams, there's certain scores we all have in mind, but it's not one part of your application that speaks to you getting or not getting in, is what the big lesson that I've learned. There is all the components, and you have to work on each component separately to have a comprehensive application. That's what we're looking for on the other side, being on the other side of interviews, being on the other side of application review. So I think exams are important, but once you've done them, put them out of the way and focus on other things. Observerships are important. Show your interest in your specialty. I know some questions about anesthesia. Show interest in anesthesia. Do observerships. It doesn't matter what level you're doing them at. And then timeline doesn't matter. You can be 3 years out of graduation. You can be 5 years. You can be 10 years. You can be recent. Your experience is unique. And like everybody else has said, we as IMGs bring a wealth of experience from outside Canada. We're diverse, and use that as your strength in your applications, in your CVs, and have somebody local as a mentor who can help you sort of edit your CV, edit your personal statement, approach doctors you know here, and anybody can be your mentor and guide you along the way. So I'll be happy. So right now I finished internal medicine. I'm a fellow in oncology here. So I'll be happy to answer any questions regarding that. Thank you, Dr. Magdoum.
Thank you, Maria. We're so proud of your achievements and where you're headed. So keep up the good work. Next speaker will be Dr. Samira Rashid. She's a family doctor as well. She was one of my residents that I encountered in High River. So I'm very lucky to have met her at that point. And so proud that she's with us today. So Samira, if you can share your experience.
Thank you for your kind introduction, Dr. Maktoum. I started my journey 12 years ago when I moved to Canada. And I just, like the others mentioned, like went through the whole exam process. There was the evaluation exam at that point, qualifying one, and the NACOSCI. And as Zoe had mentioned in her presentation, I also found the resources with the study groups really helpful. In Calgary, it was AIMGA and Directions for Immigrants, the study groups, and the networking opportunities you get and finding study partners. It was all through these study groups. So I found that really helpful. Along with this, I did multiple observerships in community family medicine as well as internal medicine in the hospital. It is also very important as to do as you go through the exam process, because I found that it not only helped me familiarize myself with the Canadian healthcare norms, help improve my communication skills, kept me up to date with all the Canadian guidelines, the clinical guidelines. So that helped me with my NACOSCI exam, the MMI. So of all those little things, 2-week observerships, 1-month observerships here and there added up, and really I felt like it really helped with my personal growth there. I was also lucky enough, like I was able to get a job as a clinical assistant at medical and radiation oncology at the Foothills. And as everyone's mentioned, how again it helps you grow. Again, you learn collaboration as you're like daily working along your attending team, your consulting teams, and working with the multidisciplinary allied healthcare team. So that's very important in the Canadian healthcare system. So it also helped me get good reference letters. I also did not match on my first round with CARMS, but AIMG in Alberta offers a clinical assessment placement where you're able to, where they send you for 1 or 2 months rotations. I can't remember the exact duration for that, but it was a very detailed evaluation where they comment on your clinical skills, communication skills, and how you do in each of the CanMed roles. So if that is offered, that really helps with your application process. I also then when I got into residency, I also remember that the CV and personal statement that everyone has been mentioning was also very crucial. The only everyone's mentioned a good tip. I would just suggest another thing that I would add is like you can tailor your, like if I was applying to, I applied to both internal medicine as well as family medicine. So I tailored my resume, my CV and my personal statement to each like separately. So that really helps as well, I believe. All the best to everyone, and happy to answer any questions.
Thank you so much, Samira. So as you know, our residency interviews were just completed in February for Calgary and all over Canada as well. I was part of the interviewing team for University of Calgary Rural Residency Program. And we are looking at not only their academics, but also what they're like as a person. So the interview was mostly about how they interact with us. And this was all on Zoom the last few years. And this year also, this was on Zoom. So you just have to be natural and then tell us about yourself and make sure that you highlight any things that are really unique about yourself. And then make sure that you are prepared with scenarios that are ethical. For example, how to deal with, an angry patient, for example, or a colleague, or, any things like that. So make sure that you write down 4 or 5 scenarios and then take experiences from your past life and write them down so that then you're ready for your interview. So everything is marked separately. The interviewing team does their own marking. The file sharing team, they do their own marking, and then the program directors, they do their own marking. So you are being assessed at different levels, and it's not going to be one person who picks you for the residency match. So that's important to know. So try and be your best at every place that you're going to be just at. So with this, I think we can now move on to all the great questions that we have seen in our list down below. So I'm really thankful to all our speakers tonight, and let's see if the panelists can answer most of your questions. So Dr. Zerka, let's start.
Yeah, so there are a few questions that I just checked. So they are asking about whether this recording will be available. So in few days, this will be available on our Apna Alberta IMG Facebook page. So I think that's also written in the chat site. So I think you can check it. So it will be available in few days. Another question that has been asked about regarding MCC qualifying 1 exam preparation session. I think you can also go back to our IMG Facebook site, and because we had a webinar before regarding the qualifying 1 exam preparation session. If anyone has any other thing to add, you can, but I think you can check that webinar for this preparation sessions. And there was another question. Somebody asked that if she or she has not done the residency program, so how that will affect this in her chances to get into the residency. So any one of the panelists who can ready to answer?
I can
You
answer
can raise
since
your hand. Okay, go ahead, Maria. Thank you.
Yeah, since I was in this position, so I was a fresh graduate. I never did any residency before coming to Canada. I actually don't think it impacts you adversely. If anything, the only thing you have to do is fill that gap somehow and, show your just be involved in the clinical situation. So I got into internal medicine with no previous training as a fresh graduate, even with clinical gap in between, but I did observerships in the middle, as I said. You can also do research courses. There's people with me who worked as research assistants as well. We didn't talk about that today, but that's another alternate path. Do a master's, do a small degree, a diploma, anything to fill and bulk up your CV. So residency definitely not having residency does not mean you cannot match.
Yeah. There is a similar question that somebody graduated in 2017, and she said that he has not done any post-graduation training and just completed the medicine. And so what are her, the best, what would be the best pathway for her? So I think like Dr. Hussain already said, I think you can work here and get the experiences from here. And I think it doesn't matter if you have not done the residency, but there are lots of opportunities in Canada to work and gain that experience.
Yes, so if you haven't done a house job and never done a residency, then definitely apply for the residency match in Canada. And it will be province specific. So wherever you live, I think that will be your best opportunity, because I think just doing MBBS training doesn't qualify you to be a doctor, because you need hands-on clinical experience, and that only comes during residency. So absolutely go through that pathway. Do you have other questions, Zarka?
So there are asked also questions regarding if you are not an Alberta resident, can you apply in Alberta? So anyone can answer that?
So yeah, no, in Alberta, you need to at least show 6 months of residency. Otherwise you cannot apply in Alberta.
So come and live here for at least 6 months.
Mm-hmm. Okay, and there is one question that someone who is already American Board of Internal Medicine certification, and he wants to come to Canada. So what is the scope for that? So anyone who can answer that question?
I think it should not be difficult for them at all, because their training is accepted in Canada. So all they need to do is apply on the physicians apply, and then most likely they will be contacted by recruiters, and then they can practice here. They will be told whichever province they go to, the college will tell them if they need to do a Royal College exam to equalize their training. But most likely they will not have to do anything if you're coming from the US with a specialist training.
Okay. So there's one question. Somebody is asking, will this recording will be available other than the Facebook? So Dr. Makhtoom, if you have the answer to that.
If Dr. Saad is online, maybe he can answer. Do we have a YouTube page as well that we can put this on?
Yeah, it will be available on the Facebook group.
So that might take a little time.
Yeah.
Is there an email on our webpage that the people can send messages to?
Yeah, I will write it down on the chat box.
Okay, great. Thank you. So I see a question here. What are the prospects of MRCOG from UK in Alberta, provided that your PR status has been expired? Dr. Saad, would you like to take a stab at this question?
I believe the route could be through the Royal College of through the surgeons. I guess that would be the route, because I can see that you would need a sponsorship for that and a working condition and the supervision for 3 months, and then the may require an assessment even before the supervision. Unless you are changing your career and you're applying for family physician jobs, especially in rural areas. If you have all the requirements with your rotations, and that could be another route.
Thank you so much. And could you also please share your pathway through the MRC GP program from UK? Because there are some people asking about that.
Yeah. So I was trained in UK. So I did my medicine from Karachi, but I went to England, and I did my house job and did all the exams before that, obviously. And then I finished my family medicine rotation there, which is 3 to 4 years. Once I finished that rotation, I worked as a family doctor for 7 years there. And then I applied for a position to work in Calgary. Again, each province has their different criteria and requirements. At the time when I applied, and there was a easy route for me, because once we have the MRC GP and have the training of family medicine, which is approved by the college here, they would actually exempt the qualifying exam. I was only required to do the evaluation exam. That used to be the case at that time. And my MRC GP was reciprocally accepted by the College of Family Physician. They may have changed the criteria. Sometimes they make you do qualifying exams part 1 and during the first 3 years. People who wants to come to Canada from UK, Ireland, Australia, South Africa, their training is approved if they have done already for family medicine. They may not have to go through this the assessment process. There may be an exemption based on their experience, their exams in their own country, and they might just be required to do the supervision for 3 months.
Thank you, Dr. Saad. That was excellent. So I will ask Dr. Samira Rashid to pick a couple of questions as well and share with us.
There was this question with regards to, this is a 5th year medical student in Pakistan, and they're wondering if there's any step that they could take, that they could take before graduating. Would anyone else like to answer that? Sure, Dr.
I can take that question. Yeah, so certainly I think you can do an elective still you have to be a medical student. So I know McGill has some electives because I remember applying to them back in the day when I was a 5th year medical student. So definitely electives are still within graduation, because after that you can never do electives again. It would have to be observerships, and electives are much more hands-on. That would be one thing. And you can also give your QE1 exam. If you wanted to expedite the process. So within 15 months of graduation, you can apply for the QE1 exam and give that. So those would be 2 things that you can do. Certainly, other than that, like work on research back home. It adds to your CV everywhere in the world. So I would say get actively involved with research projects. They really like to see that on your CV. So those would be some things to do.
Thank you.
Thank you, Maria.
Another question here is like, this person lives in Islamabad, and recently Shifa Hospital started a 1-year family medicine diploma, and they're wondering if it is acceptable in Canada for PRA.
I think as long as they've done 1-year house job and then doing this 1-year diploma family medicine, that will give them a 2-year experience. I think then it would be acceptable. But check every year, because criteria here are changing so fast that sometimes we don't even know that, criteria has changed and their requirements are increasing every time. So it looks hopeful, but yeah, do apply, do that training, and then before you come here, make sure that you check.
And also I would like to add, as I mentioned, it has to be a continuous training. So if there is 12 months of house job and then 1 year of diploma training, there shouldn't be any gap in between. So as it says on the website, continuous 24 months of uninterrupted training, we would accept that either in the form of house job plus 2 years postgraduate, 1 year postgraduate, or just 2 years postgraduate. So yeah, so but just continuing.
And I can just add one thing, that while you're doing that process, you can actually write a letter to the college. For example, the College of Physicians and Surgeons of Alberta, and explain your situation, your degree, your rotations, your jobs, what you're doing, and they can actually review your application, and then they can write you back what is deficient and what will be the steps that would be required for you to gain the license. So that would be a quite useful thing to do, and then you can just follow that route.
Thank you. Dr. Zarka, do you have another?
There's one question. Somebody is asking if a Canadian resident prerequisite for joining medical residency program in all over Canada or only in Alberta? I think Canadian, being a Canadian prerequisite.
I think it was.
I think sorry,
Yeah.
I think the requirement was, and I think somebody else mentioned that you need to be here for 6 months in order to gain for that. If you have that, then I believe you can apply for residency.
That's for Alberta. Yeah.
That's for Alberta, but I did point out that if you are looking to apply in different province, I would highly recommend you open up their page and just look into what their requirements are. It won't take long and you will go the right way by just doing a little bit of more research.
And there's a question for Dr. Saab. Can you please compare UK and Canada family medicine and life?
Certainly, I think I just mentioned very briefly 3 things. One is the compensation model is a little bit more generous. Number 2 is the bureaucracy is significantly less in Canada, and definitely the quality of life is much better. It's Canada offers one of the best cities in the world, livable cities in the world. They have great schools, and the education is very, very good, and it's the place where kids likes to grow up. So I think overall my experience has been really great.
There's one more question. Somebody asked, would MRCP certification with training done in Pakistan help in exemption of any exams or requirements?
I don't believe that there will be an exemption. You would still have to write all the exams. It might help you in the practice readiness assessment pathway. If you can show that you had training for more than 2 years, and then you practice for 2 or 3 years. I believe that's the new criteria.
Yeah. And definitely post-graduation training helps you even if you are applying for residency program. So but it will not exempt any questions. So there's one more question. If I have to choose between the 2-year family medicine practice from Pakistan versus clinical fellowship in Canada, which should I choose? Two-year family practice from Pakistan.
I think it depends
As
on.
a person.
Yeah, provided all the steps have been taken, I would prefer the fellowship in Canada, because the earlier you come here, you gain more experience. You know the system, you know the working environment, you get the references, and you are ahead of the game.
Okay.
Yeah, I would echo that. I think any local experience is better than experience back home. So if your ultimate goal is to practice here, then you should pick that.
Mhm. And another question regarding ready practice. They said, does practice ready means you already have a job?
Yeah, so
Sarah.
no, yes. So it does not necessarily mean that you already have a job here. There is a process that they have set up for you. That's why there is a whole portal, and that's why there are steps to it. Definitely they count your training, but then you have to go through each and every step. So it's not that you have a job already. It's that you will have to apply a job, and the chances of you getting into it are pretty much good as compared to those who do not have training. If that answers the question.
Okay. So there's another question. Do I need to pass additional exam if I am ABIM certified and working in US? I'm not sure about that. ABIM exam in US.
If that's an American board, then you probably qualify already. And you just have to apply for different jobs that are available all over Canada for internists. We do have several internists working here that came from the US, and some are working in Medicine Hat, in nephrology and internal medicine and orthopedics and psychiatry. So there's a lot of opportunities here. You just have to apply.
I think these are the most of the questions that we got. So if somebody finds any other question that I missed. I think there's one question regarding somebody who has FCPS ENT in Pakistan and having more than 3 years post FCPS experience. Asking, I have heard fellowship programs for IMGs. Can you guide me regarding that, regarding the fellowship for ENT program?
So our program today, I think it will be beyond its capability to talk about fellowship tonight. So I would defer to another time for that. You can definitely get in touch with the College of Physicians in Alberta and other provinces and ask them that question. I absolutely know that there are many fellows here from Saudi Arabia that, and their fellowship is paid by their home country. So they bring their own money with them. And they are doing their training here, and then their requirement is that they go back to their home country. This is part of their agreement. So I think it would be tailored to every person differently. But you would have to talk to each province, each College of Physicians separately. The bigger ones here are Ontario, Alberta, and British Columbia. And then there are several smaller provinces as well, like Newfoundland, which is on the east side of Canada, and most people land over there and then they move and then they make their way to other provinces once they have been in practice for a while.
Thank you, Dr. Sarah.
So I think we are coming to the end of our session, unless there are any other new questions that are popping up.
I know this question came up, I think the third time, about histopathology guideline, please. Somebody's done their specialization or their experience has been in histopathology.
So one of my classmates actually was a specialist in Pakistan in medical microbiology. I mean, she did all her 5-year training in Pakistan. And then she came here and she had to do it all over again. So now she's actually done, and she's been in practice in Vancouver for the last 3 years. But she absolutely had to do it all over again. So I'm not sure if that's even worth it for some people, taking into consideration the long time and sacrifice for your family that you have to go through. But it's absolutely up to every individual to decide that.
I think somebody has also asked a couple of times about securing observerships and research roles. So I cold emailed a lot of people. So every university, every program has emails of people in the department, and there will be somebody willing. And the next best way is, if you know ask your family doctor if he can refer you to another family physician. He knows who can get you an observership. So that's important. Asking around, you have to ask a lot. So anybody you know in Canada, ask them if they know anybody who would want to take an observer on. I think that's one way, and then emailing is the other way. And research positions are officially like job postings on AHS websites, similar to clinical assistant positions. So you would have to look through, for Alberta at least, AHS. I'm sure there's other ways in other jurisdictions. I don't know about that.
So this is a very important point, that you just cannot sit at home and not do anything. If you get out of the house, meet people, go to their clinics, say hello, introduce yourself, go to different meetings that are offered in your town, join associations. Like we have this Apna Pakistani Association. Then I know of many others. There's a Philippine Physicians Association. There's a Nigerian Physician Association. So there are so many support groups that you can join. And then they will help you, get the observerships. But your family doctor, of course, in Canada is your first source of connections. So we are all here to help. As you can see, all of us have been here from 1 to 23 years. So there's a lot of combined experience on this panel tonight. We all started with nothing. And with God's blessing, we are where we are today. So I think we are all very passionate about helping other doctors, young doctors, older doctors, whoever is coming to Canada. We want them to find their pathway, but the hard work has to be done by yourself. You have to clear your exams in a timely manner. Don't be caught off guard by being off cycle. So make sure that your dates are correct so that you don't have long periods in between when you clear your exams and when the residency match is going to start. So look at all of those things and make a proper plan, and then work hard, and then of course you will be successful. There's no question in my mind that you will succeed. So I think with that, we are approaching the 8:30 mark. So Dr. Saad, if I can ask you for the last words.
Yeah, I just want to thank you, everyone who was here today. Hope that the entire team has been helpful to you. And as our colleague says, stay positive, apply early, get your documents verified, choose your pathway. And we are here to help you if you need. The email is there. Our IMG website, Facebook website is there. So any one of us can be more helpful in future. That would be great.
Thank you and good night, everyone.